Hi, my name is Rob Gurney. I'm the peer support worker for the ARCH program, Addictions Recovery and Community Health at the Royal Alexandra Hospital. It's a project that started about 3 years ago. What happens is we take patients that come into the emergency room and they get consulted and see if they're in there, their injuries or infections are because of substance use. And then we have them on the units, and the medical team, our doctors, they see them, and our nurse sees them as well and does intakes and sees if they're suitable for the program. And then myself and the addictions counselor, they will go see them. And my role as a peer support worker is to speak about my own experiences with my own addiction. I was homeless for about 10 years of that time as well. And when I speak to the patients, I introduce myself as being a non-medical staff and let them know the rest of the team and what their roles are, and then my own background. And then I say that I'm not here with any real agenda, just to have a conversation and ask them how they're doing. When they realize that I'm there just as a peer, there to support them, they're able to tell me things that they may not tell other staff members because of their distrust of the system. And myself too, I had that distrust of the system as well, being a patient in the hospital here with my own overdosing and such. So the ARCH program is important for that. We have our addictions counselor and myself. We go in and see them for emotional support. We have social workers on the units to work with social aspects of it, and we have our clinical team. I'm part of it as well, but we have our medical team, we have our doctors and our nurse, and they play very important roles. They are specialized in addictions, and they work with them on methadone, Suboxone, just stuff to keep them in the hospital. I also work with harm reduction supplies, which I do education, and I also hand them out, which is clean needles and clean water. And I also do a van shift once a month with Streetworks, where we go around the city and hand out harm reduction supplies. And we're able to see, I usually end up seeing a patient when I'm out there. And it's a good way to connect with them and see how they're doing, and let them know that they're still part of the ARCH team and that we're still there for them if they need us. I meet people where they're at, so if they're still in their addiction, that's okay. I'm not there to judge. I'm there to let them know that when they're ready, what they want to do, we're there for them to help them. We had a patient that was quite into her addiction, and and she was a difficult place in her life. I'll say and it brought out difficult behaviors. And so it took what I like to call a village, and I tell the patients too, it takes a village. It still takes a village for myself, for my sobriety. And so we had the unit, we had our doctors, we had the cleaners, we had people that serve food, addictions counselor, myself, the nurse, all of us working with this patient who was deep in their addiction, was having a very difficult time, and they were coming in and out of the hospital, and it was a difficult time for ourselves and for this patient, but mostly for the patient. But we were there for them, and we kept going, we kept working with them, and finally we were able to get them on the proper program they needed to go on, which was methadone. And it was amazing the way it slowly changed. It wasn't something that happened, it took months. But we kept staying there, staying with her, and I bumped into her the other week at Dollarama, and she said hi to me, and I said hi to her, and she was happy and she was doing good. She had gained some weight, she was looking healthy. And just seeing somebody, when you're in your addiction, deep in your addiction, you don't go to where other people go to, so you're not really going grocery shopping, you're not really going to Dollarama, just living a normal, what everyday people do. And it was really nice to see that. She was shopping, and we said hi to each other, and she's doing good. I saw her again about a week ago, and she's still doing good. Still has some stuff going on, but we still chip away and let her know we're still here for her.